Good morning, good afternoon, good evening, whatever time it is that you're watching this. Today we will be discussing about the impact of telemedicine and AR/VR technology in today's healthcare system. So let's move on to our telemedicine. Telemedicine can be defined as the use of technology like computers, video, phone, messaging by a medical professional to diagnose and treat patients in a remote location.
The primary goal of telemedicine should be to enhance overall patient outcomes. One of the benefits of telemedicine is to reduce contact between patients, healthcare workers, and other patients. Additionally, the most important goal of using telemedicine is to reduce physicians' burnout remains a major concern for hospitals.
Technical details of the work. Telemedicine involves the use of electronic communications and software to provide clinical services to patients without an in-person visit. Telemedicine technology is frequently used for follow-up visits, management for chronic conditions, medication management, specialist consultation, and a host of other clinical services that can be provided remotely via secure video audio connection. Basic telemedicine practices a secure broadband internet connection. The amount of speed of the internet connection will determine the quality and the amount and spend of data transfer.
Telemedicine intervention decreased overall mortality and length of stay within progressive care units without substantial cost incurrences. With telemedicine, people can now be easily accommodated in the comfort of their own homes by healthcare professionals.
So the impact of telemedicine. Economic. The implementation of telemedicine could greatly impact a country's economy. Telemedicine is convenient and easy to access, which allows patients in remote or rural areas to have access to healthcare services. The ease of access allows patients to receive quality care whenever it is needed. Unnecessary and non-urgent ER visits or physical checkups for diagnosis of simple health issues like colds may be eliminated through the use of medicine with at telemedicine, which reduces costs for both the medical provider, insurance, and patient. This causes life expectancy and standard of living to increase because medical issues can be quickly addressed in minutes. Social. As humans, we tend to worry when it comes to our health. The use of telemedicine reduces those worries because when a patient asks for help from a medical professional, he or she assures the patient that everything will be fine, and then the patient would feel reassured and more comfortable with the situation. This significantly impacts the happiness of people and allows them to proceed with their lives without any worries. Environmental. The use of telemedicine allows patients to receive healthcare services through technology at the comfort of their homes. This allows patients to obtain diagnosis of simple health issues without going to a medical provider like a hospital or health clinic. This means that patients don't have to travel by either public transport or private vehicles. This reduces both air and noise pollution and reduces the use of materials like paper that turns into waste after it is used. Therefore, the environment would be cleaner and quieter, which essentially makes the environment better to live in.
Our next topic, AR and VR technology. AR or augmented reality and VR or virtual reality are mainly used for gaming, marketing, education, and many other fields. Both technologies are known for their enriched experience that brings together a virtual world and the real one with enhanced 3D visuals. In addition, it isn't just useful for gaming. It has been shown to help in a variety of applications, from military training activities to treatment for anxiety disorders and phobias to functioning as an art form.
AR and VR technology shows promise for helping stroke victims overcome motor deficiencies. These patients must be put in a robust environment to help regain motor control. These technologies help to improve their customer experiences by effectively engaging them in healthcare activities, and it can be used for improved self-diagnostics. This way, patients can understand the problem better and get actively involved in their treatment.
Technical details of the work. Computer graphics for render virtual world, 3D animation for visualization, avatar assistant for generating fractal algorithm, which can be codified in different computer language, simulation for planning of pre-surgical or surgical or diagnostic cases.
The application of virtual reality capabilities plays an important role in improving the performance of different medical groups. VR apps using a head-mounted display led to improvements in a number of health outcomes, including pain management, posture, cognitive functioning, specifically related to Alzheimer's disease, and a decreased risk of falls.
The impact of AR and VR technology. Political. The implementation of AR and VR technology helps the government by reducing the cost spent by the government on subsidizing healthcare education. The reduction of the use of tangible resources means that the cost would change from being variable to fixed. The reduction in costs provide the government with more money, which could be spent on other policies like subsidizing housing. Social. Since medical students require a lot of hours of training to get experience, the use of AR and VR technology helps with the student social life. Due to the boom in the development of technology, AR and VR technology is now becoming easier to access and consequently cheaper. This means that students, if required, could train whenever it suits them without having to wait for tools, equipment, and other required materials. Students therefore have more time to socialize with other people, which helps with the reduction of stress and helps the student attain a better well-being. Environmental. AR and VR technology is a way to replicate real life through the use of technology like computers. This means that students and or professionals that require training or retraining wouldn't need to use tangible resources that could be used on real patients. This reduces the wastes while providing equal or better quality of training and consequently helps save the environment.
So that will be all for our discussion. Thank you for listening.